It's July 8th, 2025. I'm Dr. Deuk Majan. We're live streaming once again from Deuk Spine Institute. And our patient is a Floridian. He has been suffering with horrific back and leg pain for a long time. Now, he had a work comp injury which injured his back, his thoracic, and his neck. He's already had an ACDF, not by me, but by another surgeon. And he already has adjacent segment disease on his neck, meaning he's got another herniation in the neck, and that's right below where his prior surgery was. He's already asked me to fix that for him. We're not going to do that today. He has got other medical issues. He's a very complicated case. He also has, unfortunately, really bad what we call venous stasis ulcers. What are venous stasis ulcers? Well, when people don't have enough circulation in their legs swell. The swelling reduces circulation even more, perfect, and it causes these huge skin ulcers to form. He's got them. I had to check him yesterday. They're not infected, so there's no evidence of infection, and he's getting them treated. And I told him, you got to have your cardiologist talk to you about, laser surgery on your veins in your legs. So he is a big gentleman, large, heavy, and not easy for me to do the surgery, but we're going to get this done for him because he's in so much pain. So we're placing our first needle. This needle is going to be placed through the skin, and then I'm going to make an incision. The incision for the surgery is 7 millimeters or 1/4 inch. You guys see that right there?
Yes, we do.
And basically, the incision is very small, okay? So there's minimal bleeding, and because the whole surgery is done arthroscopically, guidewire, there's virtually no damage internally, okay? So when patients have open back surgery, open neck surgery, the surgeon is making an incision that's bigger, but more importantly, below the skin, what you're not seeing below the surface is that they're doing tremendous damage to the patient internally. They're disrupting muscles and ligaments and tendons. So all that damage to those normal structures causes horrific pain after surgery. And that's why people who have open back surgery like laminectomy, discectomy, or fusion, they have horrific pain afterwards. They have to take narcotic painkillers for, but not with our laser surgery. With the Deuk laser disc repair, these surgeries are so minimally invasive that the patients end up not needing narcotics after surgery. No painkillers, okay? No painkillers. That makes this surgery quite unique because there are no painkillers after surgery. And by the way, this surgery is outpatient, meaning that the patient goes home very shortly after the surgery. All right, I'm trying to get the needle at 4.5. I'm not happy with the position on the AP. It looks too lateral, Sean. So I've pulled back a little bit, and I'm going to try to, I feel a lot of arthritis here. I'm going to try to get around the arthritis, but I may have to actually do a second incision higher up, which is probably what I'm going to do, because of the angle of his spine is a bit unusual. I can't get both at the same time from the same incision. So I'm going to have to make a second incision shot, but these incisions are small. Shot. Once again, I'm hitting the arthritic facet that's blocking my access to the disc. Any questions? Feel free to type up your questions.
We have a comment and a question.
Sure.
This comment is coming from Smallville 1219 on YouTube.
Hello, Smallville. Welcome.
Saying good morning, Dr. Deuk.
AP.
It's Christian. Just wanted to say thank you and your team for the great experience I had with you guys.
That's makes me so happy to hear from you. I'm so happy that you're doing well and that you had a good experience. All right, so you can see the needle is on the left side of the spine. It is up against the facet. I'm not passing the facet. I need to pass the facet. Shot. So I need to redirect. Very difficult because of the angulation of this level. Also, he's on some type of a blood, not a blood thinner, but he's definitely doesn't have normal platelet function. He's supposed to be off all of his medication. We tell everybody to do that shot. All right. Again, I'm banging up against this arthritic facet on L45 on the left. I can't get past it. I'm going to have to try to do a little bit of redirect shot. All right, let's get another AP. I think we may be off on orbit, but let's just get another quick AP. Thanks for the comment, Christian. We're so happy you're doing well. Yeah, we're too far away. We're hitting that facet. We're not able to get closer. I'm going to have to go a little bit more lateral to get there. It's fine. Shot. That's just his anatomy. Everybody's anatomy is a little bit different. Shot. Okay, so the surgeon has to accommodate the patient's anatomy, but you got to be prepared for anatomical variations among your patients. Shot. There is going to be a little bit of that in spine, especially because spine is a degenerative condition, meaning that as the spine degenerates, it changes its shape and the joints get bigger, so they start to block access. Shot. That looks pretty good on the lateral. I'm much closer now. I just need to jockey in. Now let's get an AP. I don't know. I think we can do better on those end plates at 4 there, Jordan. All right, it's looking better. Yeah, let's get back to the... You see the scoliosis, folks? The spine is a little bit twisted. Those vertebral bodies are angled. They're not straight on the AP view. Lateral. Let's try to get a wag. Let's fix the wag a little bit. I want you to go straight down the center of the 4-5 disc. Uh-huh. Yeah, that's what I was thinking. I'm a little bit too high. I need to aim down a little more. So we're going to... let me see if I can go back to my other incision and just make it work from here. Now, normally with this type of surgery, I don't think I can actually. Normally with this type of surgery, we don't get any bleeding, Sean. But with this patient, we're going to have some bleeding because, again, he's on some type of a thinning agent. I don't know what it is. Maybe an anti-inflammatory. Sean, do we know what it is? All right, AP. So he has nothing, right? We stopped everything. But clearly he doesn't have normal platelets. So it could be something like ginkgo biloba, fish oil, turmeric. Those things definitely have an effect. Lateral. Our L3-4 needle looks perfect. Our L4-5 I'm not happy with, but I'm trying to get happy with it. Yeah, I think actually, I think we're okay here. I think we're going to be able to get this. Okay, not, there it is. Aspirin. Yeah, so 7 days off aspirin. That's why. He still has some impaired platelet function. AP. So aspirin is a drug that makes your platelets not bind together. Platelet binding is the first thing that has to happen. It's called aggregation. Lateral. Perfect. That's very good. I'm very happy with that. So clearly he still has a platelet issue. His platelets aren't working, and the aspirin is what's doing that. But it takes about 30 days to make all your new platelets. And so he still has some good platelet function, just not 100%. Perfect. All right, we're in. That's good. Very happy. Now we got to go to the right side and see what we can do on the right side. So I think we're good on the alignment. I need to be a little bit higher, probably a little bit more lateral shot. So the first step in this laser surgery we do here is to place these needles properly. And if you get the needle placement done properly, the rest of the surgery goes very, very nicely. Very safe, very easy. AP. I think I'm a little bit too low. And again, it's a scoliosis that's shifting his spine and his discs in such a way that I have unequal access on both sides. So I'm very medial, so I'm just too superficial. That's the problem. I need to be deeper. Shot. superficial means towards the skin. Shot. Very good. I'm happy with that. I feel the facet shot. We're not going to do evocative on him, right? I don't think we need to. AP. So I'm getting very close to the needle placement being right on the right side at L4-5. We're doing bilateral L4-5, left L3-4, Deuk laser disc repair. Perfect. Very happy. Everything's coming together. I've just got another few millimeters to go on this right side needle at 4-5. Any questions?
Yes, we have about 2 questions. The next
Sean?
one is coming from Donna on Facebook.
So the haters haven't shown up yet.
Not yet. We're asking great questions so far.
All right, I'll take Donna's question, and then what I'd like to do, Henry, is show some video. Let's show them how patients' back pain can now be diagnosed. There are 30 specific causes of back pain, and this patient has, just before I take Donna's question, he has 2 discs that are causing his back pain, plus 1, 2, 3, 4, 5, 6 facet joints. So 6 plus 2 is 8. He has 8 causes of back pain, and we're going to fix them today. Shot? I'll take Donna's question.
Asking, if the MRI doesn't show issues on the lower lumbar, how do you
Sean?
determine if it is the SI joint versus piriformis problem?
Hey, Donna, that's a really good question. Thank you for asking. So, folks, here's the most important thing I'm going to tell you today. The MRI will never, ever, ever tell you, ever, whether or not, where your pain is coming from. The MRI will not tell you where pain comes from, okay? Now, if you have no back pain and you get into a car accident and your pain starts today, then you can look at the MRI, see a fracture, and say, okay, well, that's where the pain's coming from, right? Because I had no back pain before, I had a car accident today, and now I have a fracture. So in that case, you can pretty much say that the pain is coming from the fracture that's new. It's a new fracture, knife. But with chronic back pain, like 99.95% of people with back pain that's chronic, you cannot get an MRI and it'll tell you where the pain comes from. As a matter of fact, there is no diagnostic test, imaging, that will tell you where back pain comes from, okay? The only way to find out where back pain comes from is through what's called the physical examination, or what are called diagnostic blocks. What are diagnostic blocks? That's where the doctor numbs up a structure in your back, like the facet joint, the disc, the SI joint, the piriformis muscle with Novocaine, and you then report whether or not the pain went away. It is not a perfect diagnostic modality. There's a much better one, and it's called the Deuk spine exam. And what is the Deuk spine exam? It is our proprietary way of diagnosing the cause of your back pain. It is only available at Deuk Spine Institute. It is a combination of the physical exam, which we do with Zoom, so you can get it done by Zoom, over the internet, out. It is also using MRI and CAT scan and X-ray sometimes, and it is also using our logic, basically our AI logic, which is our database of experience in diagnosing and curing back and neck pain. That's what we use. We use those 3 things to diagnose. So, if your MRI shows nothing, how do you tell if it's SI or piriformis? For me, it's very easy. If it's piriformis, you put pressure on the buttock, the top of the butt cheek, right dead center between the butt crack and the hip, right there in the meat. It's super tender, super painful, and you can also have sciatica. If it's SI, then you push right above the butt crack to the right about 2 inches, or left 2 inches for the left and right SI, and you're going to have severe pain and tenderness there. Now with the SI, you can do a diagnostic block where you basically numb up the joint and figure out if that takes the pain away. So we need irrigation, combination of diagnostic block, and but at Deuk Spine we can do it just by the physical examination, knowing exactly where the pain source is. So my advice to you, if you want to know whether you have SI or piriformis, just do a Zoom call. It's free. We don't even charge people money or anything for our Zoom calls. You get 1 free Zoom meeting with me, 10 minutes. I review your MRI. There's a piece of herniation right there. You guys see that? It's kind of blue because we put the blue dye in there. But that was pushing on his nerve, causing his leg symptoms. Now remember, he's also got really bad venous stasis disease. So he basically has veins that are not pushing the blood back up to his heart. All right, there's the inflammatory tissue that causes the back pain right there. It's pink. Any questions?
Yes, we have a question coming from Rick on YouTube.
Hi, Ariana. How are you?
Rick on YouTube asking,
Don't piss me off.
I have a past of multiple spine surgeries, and my latest MRI findings say there is bony hypertrophy at the L3-4 disc level involving the pedicles and facet joints with central canal stenosis. Can anything be done for these issues?
Yes, thanks for asking. It's Jeffrey, correct?
Rick.
Oh, Rick, I apologize. Yes, Rick, thank you for asking. 100% we can fix it for you. It is a fixable problem. So what is bony hypertrophy? It's basically, hypertrophy means to enlarge. If you think about a bodybuilder going to the gym and working out their muscles every day, their muscles get bigger, right, over time. After about 6 months, if you look at your muscles and you've been working out in the gym every day, your muscles respond to the weights, okay? We call that stress. The medical term is stress. When you stress a muscle, the muscle's response normally is get bigger so that it can accommodate that stress. When you stress a bone, the bone's response is to get thicker bone. We call it sclerosis. When you stress a joint between bones, the body's response, the joint's response is to get bigger. The joint bone's hypertrophy, okay? So we call it hypertrophy. It's an enlargement of the bones around the joint. And the purpose is to stabilize the joint, to make it more stable so that it's not moving around too much. All right, this right here is the herniation. You guys see it, the white stuff, it's all scarred up within the annular tear. This is the cause of his back pain here at this disc. I'm going to keep working with the laser. But in the meantime, Henry, let's show the audience. There are 30 specific causes of back pain, 30, that are chronic back pain, okay? They include the 5 discs, the facet joints, which there's 10 of them in the back, and then the SI joint, the piriformis. Those are going to account for about 99% of everybody's back pain right there. Now there's also fractures that occur and a few other things like infections and tumors, but those are extremely rare, thank God. So 99% of the causes of back pain are very easy for us to fix. At Deuk Spine Institute, we can do it within just an hour or 2 surgery. Let's show them that video.
Of course.
I'm Dr. R. Deuk with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L12, L23, L34, L45, and L5S1. The most common facet joints to cause chronic back pain are L45, followed by L5S1, followed by L34, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Majan. Thanks for joining us.
Okay. Hey, we're just talking about the insurance companies are making it even harder now for us to do our treatments and get paid. They're happy for us to do the treatments, but they don't want to pay. So the latest thing is they have another requirement where we have to report more information. We can't even do it ourselves. They make us go to a third party and hire a third party and pay a third party. And if we don't do it, we lose 2% of our payment to the surgery center, which is already way too low to begin with. It doesn't cover costs. So these third-party administrators for Medicare, like Blue Cross, of course, they're not called Blue Cross, they're called companies like First Coast Services. They basically add additional responsibilities and cost to medical care, but they don't compensate us for it, and they punish us if we don't do it. It's just crazy. And it's not just unique to Deuk Spine, it's happening across the country. More requirements and less payment. That's what they do. And they just want to drive everybody out of business, and they want to consolidate all of healthcare into a few facilities, because let's face it, if there's fewer hospitals, fewer surgery centers, then patients don't want to drive there. They don't want to inconvenience. They don't want to drive 2-3 hours to get
medical care. So these insurance companies know that by closing down hospitals, and we've already seen 2 hospitals close down right here in Brevard County. We had 5 of them, 2 of them have closed down, and they're closing down because the insurance companies want them to consolidate. You see, think about it. If the grocery store is on every corner, then you're more likely to go buy groceries, right? But if you close down all the grocery stores so there's only one and it's far away, then you're less likely to go and get groceries. So you're going to spend less. That's why grocery stores open up on every other corner so that people will go there, okay? Do business. But hospitals are being closed down by insurance companies because the insurance companies don't want you to go to the hospital. So they're putting the hospitals out of business by decreasing their payments and by increasing their reporting and basically compliance issues. They got to spend more money just to be compliant with all kinds of nonsense things that the insurance companies want them to be compliant with. Okay? So by closing hospitals down, people have less access to care. This is a very scarred disc right here, disc herniation, very scarred. Look at all that. There's a little bone spur there, a lot of scar tissue, but there's also a lot of inflammation, all the red stuff. And that's what we're here to get rid of. That's what's causing his pain. Any questions?
Yes, we have a few questions. This next one is coming from Lanu on YouTube.
Well, hello, Lanu. Welcome back. Thank you for your support, by the way.
Of course, asking, some people make crackling pop sounds on their backbone when they exercise. Is
Yeah.
this normal?
That is the facet joints. That is arthritis within the facet joints. It's popping. Very common thing. It's not normal, no, but it's very common. Very common. It doesn't mean they need treatment. It just means they have arthritis and facet hypertrophy. Hypertrophy of their facet joint. That's all. Doesn't need treatment unless it hurts.
Next question coming from Donna, once more on YouTube, Facebook, asking if you...
Hold on a second. Sorry, Donna. Give me a second. Hey, Jordan. Will you see if Monica's available to do an MRI lumbar? Where is Logan? Is he not?
He wanted to work today. He wanted to be productive.
And he's not productive here?
We want to stay on the clinic side.
That's fine. He's welcome to stay in the clinic, but I mean, you guys can put them to work, you know, just because they're here, they don't have to just watch. These volunteers can be involved in, you know, little tasks around the operating room, and that way they learn and they participate. Sorry, yes, I'll take Donna's question. Will you find out, though, if Monica can do a lumbar MRI and when she's available for that? This morning.
Next question from Donna on Facebook asking, if you determine it is a piriformis problem and release it at the trochanter, and you happen to be the unlucky person where the sciatica runs between the piriformis and not behind it, will the release be a problem as opposed to taking out the entire piriformis?
No, you don't need the piriformis removed, ever. 90% of the patients that we diagnose with piriformis syndrome, and we treat them successfully with our Deuk piriformis release, which, as you know, is patented, that treatment always works 100% of the time to get rid of the sciatic symptoms. We've never had a failure, and we've done hundreds and hundreds of them now. Never had a failure with the sciatic or the buttock pain. So it works. You don't need to have your piriformis muscle taken out ever. That is something that other doctors will tell you to do because it's covered by insurance, so they just want the insurance payment, okay? And basically, unfortunately, folks, there's something happening in healthcare that you should be aware of, and that is doctors are recommending treatments to you that the insurance will cover and that they'll pay for. Doctors are no longer recommending what's best for the patient. They're recommending what's best for themselves and the insurance company. So you must be aware of this. This is happening everywhere in the world, as a matter of fact, not just in the United States. And it's been happening for years and years and years, and it's getting more pervasive. Doctors are recommending treatments that they know the insurance company will cover, even though those treatments are not the best treatment for you, the patient. They could actually be harmful treatments. They could be dangerous treatments. They could be ineffective treatments. So we typically would call those not medically necessary treatments. But the insurance companies want those treatments available for you because they don't work, basically, and they know that you're going to go read about it on the internet, social media, and find out those treatments do not work. And then you're going to basically say, no, I don't want that treatment, okay? So what we do at Deuk Spine is not what's best for the insurance, not what's best for the surgeon, not what's best for the facility. We do what's best for the patient, our patients. We're done here at this disc. Let me just take one more peek. I think we're done here. I don't see anything else. That looks pretty good. That looks really good. All right. So finished with this disc. Suction is not working. Why was the suction not working, guys? I'm sorry?
No. I said I want 1 and 2 on.
Oh, I see what you're saying. So you were sucking the bag. You were sucking the bag, not the tube. Got it. That makes sense. Thank you for correcting it so quickly. I appreciate it. Anybody get puckered there for just a second?
No.
Jordan, your legs weak? Your knees shaking? All right. Well, let's talk for a moment about the animation we showed you about 10 minutes ago, the 30 causes of back pain. Okay, that animation is very important because it highlights the 30 very specific causes of chronic back pain. Now, every patient we see has slightly different combination of those causes, but certain things occur more commonly than others, okay? And the most common cause of back pain is the disc, a disc injury. The disc is causing back pain. And the way it causes back pain is through what's called inflammation. Come on in, Jordan. So it's actually your body inflammatory system attacking a small tear and herniation in the back of the disc. That's what's really happening, okay? And until you get rid of that herniation that's stuck in the tear, until you eliminate that inflammatory tissue, you're going to continue to have back pain. So that's what the Deuk laser disc repair procedure does. We go straight to the source of discogenic back pain, which is back pain from the disc, and we treat the very specific, thank you, Luis, the very specific source of pain. Great job, Luis. Way to help. So guys, remember, he's been off his aspirin for a week, but his platelets have not fully recovered. It takes over 30 days for your platelets to fully recover, okay? And what that means is you've got about 250,000 platelets per, what is it, cc? Per ml or deciliter? You know, what is it, per 10 mil? Berndes? And you got all these platelets, right? But when you take aspirin, aspirin binds to the platelets irreversibly to a little spot on the platelet that blocks the platelets from binding to each other and becoming what's called a platelet plug. The platelet plug is a little plug that your body makes to basically stop bleeding in small little capillaries and veins and arteries. And when you can't make a platelet plug, you're just going to keep bleeding. So it takes about 45 days, 30 to 40 days to remake all your platelets, okay? And this patient has been off aspirin, so he's had all of his platelets blocked because of his cardiac history. Let's have one more staple. And he's had all of his platelets not working until we took him off aspirin a week ago. And now some of the platelets, the newer ones, the ones that are made in the last 7 days since he's been off the aspirin, those new platelets work. But only about 10-15% of the platelets are working properly. Pressure? So But that's what we have to do in medicine. We've got to balance the need for treatment and surgical treatment with the need for medical treatment. And, you know, sometimes it's a compromise. You can't win on both sides all the time. So in his case, he needed the surgery, but at the same time, he needed the platelets. So we couldn't do surgery with him on platelets, so we had to get him off for 7 days. But I would love for him to be off for an entire month, but I can't get that because being off platelets for a whole month puts him at risk for cardiovascular complications. And he's already got venous stasis ulcers in his legs. It would just make that worse. Any questions?
Yes, we have a question coming from Lanu, once more on YouTube,
Sure.
saying, question for me. When you read questions or comments, Dr. Deuk, does everyone in the surgical room also hear it? I believe so, yeah.
Yes, they do.
Yes, they do. And even outside the OR a little bit as well.
Yeah. Depends on how loud Henry is.
Yeah, exactly.
Sometimes the neighbors hear it.
Yeah. We got a few complaints. No, we haven't.
No, I'm kidding. Yeah, great question. So getting back to the cause of back pain, most of the time, 85% of the time, the primary cause of back pain is a disc injury like this patient has. And let's show the audience, Henry, here's a piece of herniation. How do disc injuries cause back pain? How do they cause inflammation, which is actually the source of the back pain?
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see from our animation that the way people get chronic back pain from the disc is first, there's going to be a traumatic injury to the disc, specifically to the posterior annulus. The annulus is right here. I'm hitting it with the laser right now. What is the annulus? It's a ligament. It's a ligament that joins one bone above to the bone below, and it wraps around the entire disc on the outside, right? So ligaments connect bones to bones, tendons connect muscles to bones. Remember that, Ariana, for your biology class. Tendons connect muscles to bones, ligaments connect bones to bones. So this annulus fibrosus is a very thick, strong ligament connecting one bone above to a bone below, and it holds the jelly called the nucleus pulposus in the middle. When you get a tear in the annulus fibrosus, by the way, annulus means ring in Latin, ring. It's a ring around the disc. When you get a tear in that ring, the nuclear material or jelly starts coming out. It's called a herniation. If it's a small herniation, everybody calls it a bulge. How's blood pressure? Good? So anyway, that herniation sits in the tear, and the inflammatory system sees it and starts a inflammatory process, kind of like a pimple. And then every time the patient gets up and moves, it's like putting pressure on a pimple. It hurts when you push on an inflamed pimple, right? It really hurts. So imagine your whole back, your whole disc being a giant pimple, and you're putting pressure on it, and it's hurting.
We have another question and a comment.
Sure.
Question coming from Donna, once more, on Facebook,
Yes, Donna, thank you.
asking, do you have any data of patients a year out of piriformis release?
We do not have a study done yet, but we have to put a study together. Just so you know, Duke Spine Institute is a small company here in Florida. We have one location, and we don't have a lot of money or resources, and we are our primary job is patient care. We want to fix people. So all the research stuff, which costs honestly millions of dollars a year to do, we don't have that kind of money. And we don't ask people for money to do research. So we get to it when we have time. We do have medical students and people interested in medical school. They do come by and do research. We have a paper we just wrote. My son Arias and I wrote with Dr. Patel, and it's on basically the animation you just watched. What are the causes of chronic back pain and how do people respond to the Deuk laser disc repair? So when you take the people diagnosed with discogenic back pain from a disc injury, and you do this laser surgery on those discs, we get rid of 99.6% of their back pain from the disc. That's the average pain relief. That's patient reported. That's not surgeon reported. In other words, I don't even ask the patients. I'm the one who does the surgery. I don't ask them. The staff do. The medical assistants do. So the medical assistants then document the patient's response to the question, what percentage of your back pain did the surgery get rid of? And vast majority of people, it's 100%. And a small number, it's 90, 95, very small. But the vast majority, it's 100% is the answer. Man, there's a lot of herniation here. You guys see this?
Yes,
I've
we
been
do.
taking out like 20 pieces so far. Okay? So what happens is I use the laser to release these pieces. Some of them are just free. They're not scarred down, but other ones are scarred down. There, I'm going to pull back. Look at that inflammation right there. That's exactly what we showed you guys on that video. There is the inflammation. Ariana, you see it? It's pink and red, just like a zit. Okay? And the reason is because of increased blood flow here. But that is the source of his back pain, right there. How's he doing, Dr. Berndes? Now look at that piece of herniation right there. You guys see it? It's kind
Yes, we do.
of folded. I'm going to go grab it, see if I can pull it out. But notice how that piece of herniation was literally right where the inflammation was. That's the relationship I discovered at Deuk Spine 20 years ago. And I've tried teaching all my fellow neurosurgeons about this procedure, but they don't want to hear about it. They want to do invasive surgery that they get paid a lot of money for. That's why they're all recommending these invasive treatments to patients, because most of them, in my opinion, many of them are getting kickback. They're getting money from the companies that manufacture devices. Okay? Now that's my opinion. I'm entitled to my opinion. And that's based on my observations over the last 29 years in neurosurgery, watching what's happening. I couldn't understand why, when I went and spoke at the American Association of Neurological Surgeons, at the Congress of Neurological Surgeons, I submitted the Deuk laser disc repair data, abstract, all of our results, and it was peer-reviewed, and it was approved for presentation and posters. And I went there and I presented all these technique of how we do the surgery and the results we are getting, which is far better than any fusion or artificial disc or laminectomy or discectomy or spinal cord stimulator or any other device or implant that they're trying to sell and push on patients these days. So we have literally the very best results. I published it. I've gone and given lectures at these meetings, the Florida Neurosurgical Society, the Southern Neurosurgical Society, the Global Spine Conference over in Hong Kong, the World Congress of Brain Mapping and Spine in Los Angeles. All these presentations I've given, and these surgeons don't want to do this surgery because it doesn't get, most of the time it's not covered by insurance, and they're not going to get paid. And that's their primary reason. Okay, they don't know how to do it. They don't want to know how to do it. They're not going to make the big bucks like they make doing invasive surgery.
We have a couple more questions.
So why am I talking about it? I'm talking about it because patients need to be aware that there are less invasive surgeries, safer surgeries, better surgeries than perhaps what their doctors are recommending. And if you just go with what your surgeon, your local spine surgeon is recommending, it could be a far more dangerous and less successful type of surgery than having something like the Deuk laser disc repair or the Deuk plasma rhizotomy for your facets. But yes, I'll take the question.
This first one is a comment, yes, coming from Smallville 1219, once more on YouTube, saying, you know, Doc, I've watched so many of your surgeries, and I look at the MRI pictures you guys have up during your surgery, and I think to myself, how the hell was I even walking at all with how huge mine were?
Yeah, great question. I mean, great comment. You're right, and that's something that's very important for people to understand. The MRI does not tell you how bad it really is, because it could be a small herniation causing horrific back pain, or neck pain, or thoracic pain, for that matter, okay? That's why you can't just look at the MRI. The MRI doesn't paint the picture, most of the time. In your case, you probably had a humongous herniation. Yeah, it's amazing, isn't it? But in some patients, remember, the herniation by itself doesn't cause any symptoms. It has to create inflammation within the annular wall to get back pain, and it has to push on nerve roots or spinal cord to get neurological symptoms. So if you had a big canal or a big foramen, and you had a lot of room because that's just the way God made you, then you had a big herniation. Well, it may not have been big enough to really put any pressure on the nerve root. So somebody else, though, may have a narrower spinal canal, a narrower foramen that they're born with, and that same size herniation would end up causing symptoms, where in your case it may not have. Does that make sense? But it sounds like you did have symptoms. They just sort of maybe didn't treat you. I don't know. I don't know your particular situation. But yes, you never just look at the MRI. That's why you need a doctor like me who has lots of experience treating these conditions to tell you what the real problem is. The MRI will never tell you where your pain or symptoms are coming from. If you don't believe me, look at some MRI reports. You'll see. You'll never see the radiologist say, the L4-5 disc herniation is causing the patient's back pain. The reason is they're not clinicians. Radiologists are not clinicians. They don't treat patients, really. Normally they don't. Now there are some radiologists that do interventional radiology and they do treat patients. But vast majority of radiologists reading MRIs, they just sit in a dark room at a computer and they look at the films and they read it. But they have no clue what's actually causing that patient's symptoms. That's why there's a huge disconnect. You need a surgeon who treats pain and understands the source to be able to diagnose it. And it's not from the MRI. It's from the examination of the patient, which is a dying art, by the way. A lot of patients tell me their doctors never even examine them. They never put their hands on the patient's body. You cannot diagnose someone's back pain without putting your hands on their body or somebody else's hands on their body. You must touch. You must touch and localize. You know, it's absolutely essential. That'd be like a cardiologist diagnosing a patient without examining their heart, using a stethoscope or checking their pulse. It's just not possible. All right, I got about 30 seconds on this disc, and then I'm going to switch to the right side if Dr. Berndes gives me the green light. Yes, no, maybe so? All right, we got the green light. Patient stable, breathing good. Is he on the CPAP? Is that working good? All right, good. So we got the green light to do the third disc. Patient's stable, doing well. Yeah, if we can. Just keep an eye on him and let me know. Any other questions?
Yes, we have a couple more questions. Next one is coming from Lanu, once more on YouTube.
Sure.
Asking, does any of the interns think you are old-fashioned? Many young people these days couldn't relate to older generation.
I think you're right. I think you're absolutely right, Lanu. I am old-fashioned. I have old-fashioned values and beliefs, but those beliefs and values got me here, and I'm not going to abandon them just because other people don't believe in them. You know, I was brought up with great values. I was brought up reading the Bible, for example, and the Bible teaches people how to behave, basically, how to live peacefully and socially. It gives you a roadmap, and if everybody just follows it, the advice, and there's other books too, you know, the Quran and the Torah. You know, the Bible is not the only one, but the teachings of respect your neighbors and your friends and people that you deal with, and be honest and have integrity and work hard, and those kind of principles I think are very important, and they've made me successful at being a doctor. They've made me successful at helping people get better. So I'm a big believer in the teachings of the Bible. I'm also a believer in punishment. I believe that young people must be punished to grow up and become adults who function properly. You know? If you don't have punishment as a child by your parents, your teachers, then you're going to grow up spoiled and expecting everything for nothing. Privileged, so to speak. So I think punishment is very important. Yes, I am old-fashioned. A lot of people don't believe in punishing anymore. When I played sports as a kid, there was one trophy for first place. If you got second place, you didn't get a trophy. If you got third, fourth, fifth, sixth, you just had a feeling of next year we're going to try harder and do better. We're going to practice more. We're going to come back and try to win. I mean, that's it. You left empty-handed, and you left with the sense of remorse, like, you know, defeated and unhappy, unsettled. And that causes people to try harder the next time, right? I think that's important. So those are sort of old-fashioned principles, right? Accepting defeat, wanting better, pushing yourself harder to do better, to win. When I was young, people wanted to win. We played soccer. Everybody, all the teams wanted to win. Nobody went there to lose. Everybody wanted to get that trophy. It was important. All the teams wanted to win, so everyone was trying their best, practicing, playing. And I think that's important. Human beings need to try their hardest and their best, do their best, and not just go about things half-assed. I don't know if I answered your question, but I hope I did. All right, so this left side is done. I had to make 2 incisions, as you can see. And we're going to go to the right side and do the third disc repair on the right side. Any other questions or comments?
Yes, we have a couple more questions.
Before we get them, let's go ahead and show the audience, since we showed them how a disc injury causes back pain, let's show them how we get rid of the back pain that comes from a herniated disc.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Hold on. Let me see. Wait. All right. That's fine. Go ahead and take it out. Alrighty then. We're in. We're in. You're doing great, my friend. Just lay still. You're doing great. Any questions?
Yes, we have a couple of questions. This next one is coming from Rick, once more on YouTube,
Yes, Rick.
asking, do most or all ruptures of discs rupture towards the nerve roots, or do any disc ruptures actually rupture the other direction?
That's a great question. Yes, the disc ruptures happen in every direction, front, sides, back. The only ones that cause back pain are the ones in the back. The only ones that cause leg pain or leg symptoms like weakness, numbness, tingling, we call it radiculopathy, are the ones pushing towards the back side, right and left or center. So great point. Yeah, disc ruptures happen all around the disc, but none of them are painful except the ones in the back. And we've talked about why that is. It has to do with the nerve fibers that innervate the back of the disc. There's a nerve back there called the sinovertebral nerve, and that's why that nerve actually is what's called the somatic afferent nerve, and it projects the fibers to the part of your brain that lets you feel exactly where the pain's coming from. All right, hopefully this one will not be a long one. Yeah. Monica's available? You want to go see what it's like to get an MRI done? I'm sorry? Yeah, but it takes about 45 minutes from now. You want to go? It'd be a good experience for you to lay in the machine and see what it's like. That's fine, we can do another day. I'm just saying, I think it would be valuable for you to do. All right, any other questions?
Yes, this next one is coming from Faisal on Facebook.
Oh, Faisal, welcome back.
Asking, hi doctor, can I ask what does oedema and signal change mean, and what's the treatment for this? Is it due to compression, inflammation? Thank you.
Yeah, so the edema is edema, we say edema, and it's, some doctors spell it edema, others oedma. The old Latin way of spelling edema is oedma, so it's the same thing, it's edema. It just means that you have extra water in your tissues in an area called the extracellular matrix. Okay, so where did that water come from? It came from your bloodstream, and it comes from inflammation. So inflammation causes your blood vessels to become leaky, and the leaky blood vessels leak out water, or salt water basically, into the area around your cells. Remember, your tissues are made up of cells, clusters of cells bound together with blood vessels and connective tissues holding it all together, okay? So edema means you've got swelling happening in a certain tissue. Now in your case, you may be referring to edema in your spinal cord, which is very bad, and it's a sign that the spinal cord is swelling, and it's very abnormal. So it usually comes from inflammation or pressure from a herniated disc, for example, pinching on the spinal cord causing swelling. Thank you. I got 5 minutes left, and then we're going to be done with the disc, and we'll move on to the facets, as long as we have the green light again from Dr. Byrne. There's your tear, by the way, right there. You guys see it?
Yes,
and
we do.
this is the herniation stuck in the tear. This is why we're here. Any other questions?
At this moment, no current questions.
All right. Folks, next we're going to be treating his facet joints. That will be a separate stream. We're going to do bilateral L34-4551 to treat his facet joint pain. Feel free to watch our animation on the facet joints and how they cause pain, and then how we treat them with a permanent pain relief with a procedure called the Deuk plasma rhizotomy.
For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922. Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, welcome back. Any questions?
Yes, we have a question coming from Faisal once more on Facebook saying, Doctor, it's coming from T4 facet joint on the odema comment from earlier. It cracks and the odema and signal change is spotted at that area. How would you treat this? Thank you.
If there's no symptoms, I wouldn't treat it at all. I'd leave it alone. If there's symptoms, I'd want to know where are the symptoms coming from. Is it coming from the disc or is it coming from the facet? That's something I have to decide through my physical examination and possibly some additional tests. So, no treatment unless there's symptoms, and I have to decide if there's symptoms through my examination. That's it. That's simple.
We have a comment and a question. This comment is coming from a patient from 12 weeks ago saying, thank you, Dr. Deuk, for fixing my back after 4 years. My DLDR surgery was 12 weeks ago today, and my leg symptoms are recovering too.
So happy to hear that. Huh? Yeah, pause. Like, stop. Like, come out. Come out with the tube.
I need 5 minutes to get an IV stomach. I can't have you stimulate the patient trying to put it.
All right.
I need a pause, not a stop.
All right, we're just going to hang on for a minute. We're going to get an IV placed. I'm not going to stimulate the patient, but I'll take questions. But thank you so much. Scope off.
This next question is coming from Donna once more on Facebook,
Hi, Donna.
asking, can facet joint pain mimic sciatica?
Great question. So the question is, can lumbar facet joint pain mimic sciatica? The answer is yes, but not technically yes. The reason why facet joint pain can radiate, and it's called referred pain, down your leg. It can go from your back all the way down to your knee, but it never goes past the knee. So if you have any pain or symptoms past the knee, it is not from the facet. It must be from a nerve going down your leg like the sciatic nerve. The most common thing to mimic sciatic pain, instead of being a herniated disc, is going to be piriformis muscle tear and piriformis syndrome. That's something we can fix at Deuk Spine. Great question. So facet pain can go down your leg all the way to your knee, but never past the knee. Never past the knee. How are we doing over there? All right. Can I proceed?
Nope.
Let's take a look at one of these pieces of herniation. Can you see this, Henry?
Yes, we can.
Now, that's just one of about, maybe 100 pieces that came out. And you can see from our ruler here that these pieces of herniation can range from, half a centimeter, 5 millimeters, all the way up to a centimeter or 2 centimeters. We've even had a few that were 30 millimeters or more. See the pieces of herniation? She thought it was attacking her. Is it contagious? How much time till I can dive back in? All right, any other questions?
Yes, we have a couple more questions. Next one is coming from Professor on YouTube,
Hello, Professor. Welcome.
asking, is it possible to create a website where someone can register as an individual and get answers, example, about the cost of a procedure and or treatment?
Yes. Yes, we offer, for everybody out there interested, Deuk Spine Institute offers a free MRI review. And what that means is if you or somebody you know has back pain, neck pain, thoracic pain, any kind of pain in their spine, all you got to do is fill out a short questionnaire on our website, deukspine.com, so that we have some information like where is your back pain, how long have you had it, where does it go, do you have leg symptoms, which leg, kind of simple questions. And then you got to give us your MRI. We need to see the images, we need the report. Now once we have your MRI images and the report, we schedule you a 10-minute Zoom call. And in that 10 minutes, I will diagnose what's causing your back pain or neck pain. And once we have a diagnosis, we know exactly what treatment you need. The best treatment available in the world for your problem. The safest, the most effective, the most durable. The treatment that will last, the fastest recovery. So we're going to give you that answer during that Zoom call. Now we can't do a Zoom call unless you first give us your MRI and the report and fill out that form. But it's free. There's no money. You don't have to pay for it. You get one free MRI review. Now once we know what treatment you need, you're going to get a call from our scheduler a few days later, and they will tell you exactly what your out-of-pocket costs will be. Now, what is an out-of-pocket cost? Out-of-pocket means what you have to pay. And that all depends on your insurance. That depends on what surgery you're having done. If you're having 1 disc or 3 or 5, if you're having the discs and the facets or the SI or the piriformis, there's so many possible combinations. Remember, there are 30 different causes of back pain. So if you're only having 1 cause fixed, that's one thing. If you're having 5, it's another. So that's the only way to get the cost of what it costs and what needs to be done. You've got to do the MRI review. We do not make a diagnosis based on an MRI. We do it based on a physical examination and the MRI. All right, so here we are. Look at the inflammation right there. You guys see it? The red stuff?
Yes, we do.
So we're back in here with the laser, and I'm going to start zapping this stuff away. Now we're doing what's called a debridement, annular debridement. That's the name of this procedure. I'm the first in the world to do it. We published it many years ago. I started doing these annular debridements 19 years ago. And I termed it annular debridement because that's really what it is. We're debriding the annular tear. We're not doing a discectomy. We're not doing a laminectomy. We're not doing a foraminotomy. We may do a foraminoplasty, but not a foraminotomy. Okay? So all the standard type of invasive surgical procedures that other surgeons do, we're not doing any of that here. This is a novel, unique procedure, unique to Deuk Spine Institute and a few other doctors who know how to do it, and and actually do it. Our laser fiber is a bit frayed on the plastic sheet outside. You see that? All right, I got about 3 minutes left, maybe 5 with this. You want to clean it? Laser off?
I will probably need
Stripper?
let me see. Bring it anyway.
Now, nobody get angry with me because we're asking for a stripper, okay? The stripper is a tool that takes the blue plastic covering on the laser fiber, which is glass, by the way. Look at that. That's pretty cool, huh? So what you guys are seeing right there are almost individual red blood cells. Oh, you can actually see the individual red blood cells. That's how zoomed in we are. But that's the inflammatory tissue leaking right there. Just tiny little bit of leakage, okay? And you can, if you look carefully at that cloud of blood right there, you can actually make out individual cells. That's how magnified and beautiful this view is. It's incredible. There is no other surgery in the world like this. Endoscopic spine surgery is very, very special. It is the future of spine surgery.
We have about 2 more questions.
Sure, we have about 2 more minutes. So,
Perfect. Next question is coming from Todd on YouTube,
hi Todd, welcome.
asking, how reliable are the documented lumbar nerve pathways, L5 nerve pathway in the lateral and lower lateral leg, to accurately indicate the source and specific lumbar nerves?
Yeah, not reliable. That's a short answer. They're not reliable. Now, if you think it's L5, it could be L4, it could be S1. So it's probably plus or minus a nerve, would be probably very reliable, up to 95% reliable, plus or minus a nerve. So if you're thinking L5 distribution, it could be actually L4 or S1, the nerve before and the nerve after. That's based on my many years of treating these conditions every single day and being an expert on them. So I would say those diagrams in the books are not, you cannot bet on it. There's a lot of variation. All right, we're just done. I'm going to clean this last bit up and we're going to be done with this disc. I feel that he's going to do really well. And once we get his facets treated, we're going to get rid of all the back pain in this area. That doesn't mean he won't have back pain in another area, but the areas that we know about where he's having his back pain will be treated, okay? I didn't find any other causes of back pain when I examined him, but sometimes about 25% of our patients, they end up developing a third or fourth cause that we didn't know about. And they could end up developing it days, weeks, months after surgery. So we always tell everybody, we can only treat the pain we know about, and if we don't know about it, we can't treat it. We're not going to recommend a treatment for something that isn't painful for you. So 25% of our patients end up coming back and getting additional treatment for additional pain sources. Scope off. All right, great. All done. We're going to move on to our facets. Any other questions? I think there's one more.
Last question from Faisal, once more on Facebook, saying, Doctor, it's coming from the facet joint on the T4 segment. Symptoms are pain and sometimes numbness on the arms and hands, lower neck, and can cause headaches and hot, sweaty hands and arms.
Yeah, there's 100% that the T4 facet is not causing those symptoms. 100%. So that is incorrect. Those symptoms are not caused by a T4 facet problem. You need a real diagnosis, and I think you have one. I think you're just one of those people who just love to keep asking the same questions over and over again and hoping that you get a different answer. Huh? And you might get that with other doctors. You're not going to get that with me. All right, let's bring in the fluoro. We're done with the stream. We'll be back shortly for our facet treatment fluoro stream.